Hi, everybody. This is Bernadette, and I want to say welcome to Left on the Table. I'm here today to have a discussion with someone about an issue that constantly gets left on the table on the Blue Dot Family Live show. My guest today is Jon, Blue Dot in the Bluegrass, familiar voice on the Blue Dot Family Live show. And Jon is very familiar with our issue on the table today, which is healthcare. Welcome, Jon. Welcome.
Bernadette, thank you so much for having me on Left on the Table. I love the idea. And I just want to say how incredible the Blue Dot family is, and I'm honored to be a part of it. So, and to all those listening, make sure to check out the Blue Dot in Texas YouTube channel and Facebook page. It's just an incredible family, and it's an incredible show.
How did you come about finding Blue Dot Family Live?
Well, I am addicted to YouTube. I love YouTube. I found that, you know, if I sit in front of the television all day and watch the cable news channels, I get really mad. I get really depressed. It's sensationalism, and so you know, I watch Midas Touch and some of the other popular podcasts. If you know, so I love all of the progressive media that's out there. And it just popped up in my algorithm. I guess, it knew that I would probably, the algorithm knows. And when I saw the show, Blue Dot in Texas, I clicked on it. I watched the first few minutes of one of the live shows, and I thought, how unique, what an awesome idea, because that's what I feel like. I feel like I'm a blue dot in my state of Kentucky, and I thought, what a way to put something together. So yeah, that's how I found Blue Dot Texas.
All right, cool. And we welcome everybody to the show, and we welcome everybody to use their voice on the show. And you come in and you drop this issue on the table all the time, and then the conversation kind of moves on. And that's why you're here today. You are actually in the healthcare industry, is that correct?
That is correct. I've worked in healthcare since 2006. I went to college for nursing. I got a registered nursing degree in 2006, passed my boards, all that. And my whole idea was to become a family nurse practitioner from the start. So I continuously just went to school as I worked full time as a registered nurse, and graduated from University of Cincinnati College of Nursing in 2011 with a master's degree, family nurse practitioner, board certified.
Awesome, awesome. And so, family nurse practitioners um, actually provide primary health care to people, is that correct?
Yes, that's correct. Family nurse practitioners are um, we are trained in a much different way. When you compare us to doctors or physicians assistants, a lot of people often, um, I think they kind of see it as a step up a ladder approach. I think a lot of people, I know I'll speak for how a lot of people think around here. They think, well, nurse is under, that's got to be below a doctor. So therefore, a nurse practitioner would be below a PA, and a PA is below a doctor. And it's not that. Nursing is its own field. And so the way I explain it to folks is that if you're going to college and you become a nurse, and let's say you become a nurse practitioner, you took a track that kind of goes alongside of the medical field of a medical school journey. But you can't just jump over and step up. You would have to go back. You would have to redo a lot of your um, pre-med requirements and go into medical school, and you would have to complete the entire medical school program.
So it's not really like a stepping stone into saying becoming a physician's assistant or a doctor. It is
Right.
its own field in the healthcare industry.
That is correct. It is,
Okay.
a nurse practitioner is a registered nurse,
Hmm.
and the um, technical term is advanced practice registered nurse. So what we do is we are registered nurses who um, may get a bachelor's degree in nursing, which doesn't really change anything. It just your level of education increases, but you're a registered nurse, and you may have more employment opportunities as a bachelor's degree prepared registered nurse. But when
Okay.
you take that next step and you enroll into like a master's program, there are actually several branches too of advanced practice nursing. So you've probably heard of nurse midwives,
Yes.
nurse anesthetists, and nurse practitioners. We're all kind of in the same family. We're like brothers or sisters, but uh, they're individual tracks that you can take in pursuing a master's degree in nursing. And now they have another step that I really like. I've not done it. I don't think I will. I'm too late into my career. Who knows? But they have what's called a DNP program, a Doctorate of Nursing Practice.
Ooh.
So someone like myself who, I'm a board certified nurse practitioner. If I completed that doctorate, I would be doctor, I would be a doctor. Just it's not a
In the
PhD doctor.
nursing practice. Right.
Exactly.
Yeah.
Uh,
And you know what? Never say never. It ain't never too late to do anything. You're almost
That's
there.
right.
So you come on to the Blue Dot Family Live Show and you drop little snippets about healthcare in America all the time. And those issues always get left on the table. That's the reason why I brought you here, and we're going to talk about that in a little bit more in depth and let people know what it's all about and how it ties to their vote.
Absolutely.
I hear, especially down in the South, I hear people down there sometimes say that they don't like Obamacare, okay? But they'll also say they love the ACA. Can you explain that to me? What is the ACA and what is Obamacare?
Well, they're the same thing, Bernadette. The Affordable Care Act is the official law that was passed, and everybody calls it Obamacare.
Right.
But the Affordable Care Act is a comprehensive, well thought out program that does a few things really well, in my opinion. What I believe the strength of the program and the brilliance of the program is that President Obama was able to do something that a lot of people have kind of thought about. They had bridged together the power of government and private industry into one kind of cohesive plan. And that's how the Affordable Care Act or Obamacare works. So if someone says they don't like Obamacare, but they love the ACA, they just kind of need to read up a little bit. It's common to hear that.
I hear it all the time, and that's why I asked that question specifically that way, because of course I knew it was the same program, but people get stuck on names, and
Sure.
to say that you don't like Obamacare and that you do like the ACA, um, it's the same program, y'all, and that's the point of doing these kind of discussions is to bring that information to the public, let you know you're talking about the same thing. President Joe Biden just made a statement on January 10th of this year. So we're just talking a couple of weeks ago, a week or so ago. And he said, I just want to read the opening of his statement. He said, today we had hit a major milestone in lowering costs and ensuring all Americans have access to quality, affordable health care. A record breaking 20 million Americans have enrolled in healthcare coverage through the Affordable Care Act marketplaces. And on the 16th of January was the close for open enrollment for this particular year. He said he also goes on to say, within 6 days left, still left to get covered, 8 million more Americans have signed up for the ACA coverage, and that's more than when he took office. You got some numbers on how many people are enrolled in this act, this Affordable Care Act, don't you?
I do. And I do want to do this just kind of before we dive into this.
Mm-hmm.
Um, just as we get started here today, let me just say, for everybody that's listening, that for full disclosure, um, I am not endorsing any specific insurance plan. I'm not paid to speak by any investors, outside influencers, or political organizations. And I just would add that my comments here are from my own research, and they're my opinions.
Yeah, and when people go to the marketplaces, there's more than one plan that you're able to choose from
Oh, absolutely.
and covered by a wide variety of insurance companies out there. So do some research, hop onto a plan that you can afford, that will give you the coverage that not only do you think you can afford, but will be beneficial for you in your life. We're just here disseminating information. We're not promoting anybody or anything else. What we do know is that if you're not covered, oh boy, and you have to go to the doctor, going through emergency is not where you want to go without some kind of insurance. We're just here dropping numbers and dropping information, not promoting anybody or anything.
And that's a great segue into something that I wanted to kind of do real quick. And no, first off, your question. As of March of 2023, so 9 months ago, whatever, roughly 40 million Americans have coverage under the ACA.
That's
So
amazing.
it's incredible. And, you know, I look back at my life, just my own personal experiences, and that everybody's driven to do things for different reasons. And I can remember when I was in the sixth grade, I woke up one morning and my abdomen was hurting so bad that I couldn't get out of the bed. And we had a three-story house, an old basement, living area, and an upstairs. I slept in the upstairs. I banged on the floor, and my dad got up real early every morning at 5 o'clock, and he came up and helped me out of the bed. And I walked downstairs, and just I was so sick. I didn't know what was going on. He didn't know what was going on. I started vomiting, and we waited for the local clinic to open up. We didn't have insurance. Um, we walked in. I was treated by a physician's assistant. Great guy, still around here today practicing. And he did pressed on my belly, did a blood test. This was back before you could just get a CT scan so easily
Mm-hmm.
as you can now. He said, "Look, you've got appendicitis, and you've got to get this thing out
Mm-hmm.
now." So, he sent me to the hospital. My mom took me home. We grabbed a bag. We went to the hospital. I had the surgery done, stayed in the hospital 3 days, did my follow up post surgical visit, and then the medical bills started rolling in. My dad owned a small country grocery store, and it had been in our family for a couple generations. The old wooden floor store. We weren't poor. We didn't feel poor, but we were, within that poverty line. We were living essentially in poverty. We didn't feel
Mm-hmm.
like that, but that's just a fact. And my dad was the kind of guy who he paid every cent that he ever owed to anybody. And I remember when the bills started coming in, and I had to go back for one final checkup. My dad put together the money to pay the surgeon. And he walked into the room, and he handed the doctor an envelope of money. And the surgeon wouldn't take it. We were just lucky. And but what
Wow.
a great guy, what a great guy. You just don't see that kind of stuff nowadays. But we were lucky because we were uninsured, but we had a doctor who decided to give us a break.
Right.
And my dad insisted that he take the money, but the surgeon was just as adamant, and we were able to at least get away with not paying the doctor for the doctor's fee.
That's an amazing story, John. Just a couple of months ago, my grandson running through the house slipped and fell and went headfirst into a wall, and I watched a knot raise up on his forehead right in front of my eyes. And after a few minutes of putting some ice on it, he started complaining about having a headache. And so my son, who was unemployed at the time and didn't really realize that his son was still covered by Covered California here in California, was reluctant to take him to the hospital. And I'm like, I don't care what the bill is, take him, take him. And come to find out, he was still covered by Covered California. And the very first thing they went in and did was a CT on his skull to make sure that he didn't crack his skull or have a concussion or anything else like that.
That's why, you know, why do we need insurance? Why do we need health insurance? This is why,
Yeah,
you know,
exactly. Because
accidents.
accidents happen.
Yes,
Accidents
yes,
happen. And you wake up one morning and your stomach hurts. That's not an accident. It's just something that happens. And a lot of people get,
exactly.
and a lot of kids get appendicitis.
It happens every day. And and
Every
and
day.
so here are five big um, health issues that just right off the cuff we can pull out. Why do we need health insurance? Well, we have
Hmm.
roughly 38.4 million Americans, or 11.6% of the population, that have type 2 diabetes or type 1 diabetes. 90 to 95% of that 38.4 million has type 2 diabetes. The most common type, develops later in life. It's just
Hmm.
type 1 is a very serious condition. I've diagnosed a lot of young children with type 1 diabetes. This is when you do not make insulin. You have no insulin, so you have to have exogenous insulin. Hypertension. Half of Americans 20 and up, or 122 million people, have hypertension, and hypertension is known to lead to heart disease, kidney disease, a stroke, all kinds of bad stuff. Heart disease. 18.2 million Americans have heart disease. Heart disease deaths. 699,659 deaths due to heart disease in, I think, 2022. And then we've got cancer. 1.9 million people diagnosed in 2022 with 607,790 deaths. This is why we need health insurance. People get sick every day. And, we, as parents, I'm a parent, I have two kids, if we get up and my kid has a fever or sore throat, we can take our kids to a medical practitioner. Sometimes I can take care of it myself, but I think it just goes back, Bernadette, to what do we ultimately need in our life? We need peace of mind and security.
Correct me if I'm wrong, not to interrupt you, but correct me if I'm wrong. Any of these diseases that you just named and you just gave numbers for would have been considered a pre-existing condition prior to the ACA.
Yes, yes,
And thus, insurance, if had you gone and bought it in the regular marketplace prior to the ACA, you would have been denied access to health care with any one of those
absolutely.
diseases,
You would either be denied, or they would essentially deny you by saying, look, this is going to cost you $2,500 a month.
which is
Uh,
just another way of denying you
yeah,
because they know that you can't afford that.
but yeah,
Yeah.
Um, going back to security and peace of mind. So I run a private solo medical practice here in rural Appalachia, and I've done this job for 6 years, my own business. It's a challenge, but It's been the honor of my life to provide healthcare services to the people of my region, the people I know the people that were my teachers growing up, the people that were my coaches in sports, to see one of those folks walk into our office, which is just me and my wife. We do everything.
This
Um,
is your community that you're
this my
providing a
community.
service for. Yeah.
So many of our people come into our little clinic, and we've got bigger health systems around, and they're great health systems. We serve, a smaller population of people because we're just a smaller clinic, but that has a lot of benefits in its, in that, a lot of times when our patients leave, it's so common for us to say, we'll see you next month, and some older gentleman say, "Hey, I love you guys."
Mm,
And we say, we love you too. Call us if you need anything. Because that's what we want and that's what we need. We need that
mhm,
kind of connection with folks. But, security, peace of mind, I think of three big pillars: financial security, I think retirement, and I think of health insurance. And I
mhm.
think a lot of our younger folks, they're getting the financial security part down. It's not easy, um, but with hard work and some dedication, that kind of starts coming into view. And 10, 20 years of putting in employment, and you're paying into your Social Security, which takes care of the retirement part at a basic level. And of course, you can add to that by putting into your retirement portfolio. Some people do investments, savings, whatever. But none of that matters if you can't maintain your health.
That's
So
correct.
health insurance is it's what holds everything together. And for a long time, that just wasn't easy to get. And now it is easy to get health insurance now.
Right on. Well, one thing now I want to bring up with you, and I know is near and dear to your heart, that our president, our vice president, and Dr. Jill Biden will be talking about later on today: women's reproductive health.
Absolutely. Where where are we going with this, Bernadette? When we look at these archaic laws that are that are limiting women's reproductive rights in such cruel ways.
It's unfathomable, to be honest with you. I never thought that we would be going back to some really antiquated ways of limiting healthcare in this country to the point where women and children can die from these laws that are being placed upon the books all across this land.
I personally, and I'll just be honest, being around some of the folks in the Blue Dot family has sort of shaped my opinions even more. And I personally don't like the word abortion. Um,
Thank
it's
you for that.
I don't. I think that it's a term that's just got too much. It's too political. I
It has.
sometimes you may
Hmm.
hear me on the show say terminating a pregnancy, or I mainly just will say, a woman's right to choose or women's reproductive rights. That's
Hmm.
kind of vague, but when we are looking at terminating a pregnancy, we are looking at a medical decision that is absolutely part of the process. Sometimes a pregnancy just doesn't work out. Sometimes we have these horrendous situations where a 9-year-old or a 10-year-old becomes pregnant through some evil rapist or incest. And, that I know that people know this. It happens,
It happens. It happens all the time in this country.
and we cannot say that this is okay. The thought of it infuriates me. I just think of my daughter. My daughter is almost an adult now. But to think back when she was 9, 10, 11 years old, of
Hmm.
her having a child, This is some sick shit, Bernadette. I don't understand it. I don't understand it.
To me, it's like a form of control. Um, I'm going to control what you do, no matter what you say, what you believe, or anything else like that. This is what I want. I'm in control, and so I'm going to make laws to make sure that you have no choice in the matter. Yesterday was the 51st anniversary of the passing of Roe versus Wade. And last year was the year that the Supreme Court decided to take that right away from women after 50 years, half a century in this country. I was flabbergasted. We should be in the streets, but we're instead going to tie this to the next election because women's health care is going to be on the ballot. Ohio, they put it on the ballot and they voted for it. Now the legislature has since moved to try to strike it back down and put all these kind of restrictions on it passing into law. But the people have decided that this is what they want. They did it in Kansas. They did it in Ohio. They've done it in Michigan. We're in Florida here recently. They got a ballot initiative to put women's health care on the ballot down there. And Florida is a quasi red state. There's got to be a lot of Republican women who put their names on that petition to get that amendment on that ballot. So it's happening all
Yeah,
across this country. And it is
yeah.
going to be on the ballot. And like I said today, the president and the vice president and the president's wife, Dr. Jill Biden, will be speaking on reproductive rights in our society in America and how we need to get them back in office so we can codify Roe. Not just them, but people who's going to move this to where it needs to be because without women's health care on in this country, a lot of people are going to die. Women are dying already, and women are being prosecuted for having spontaneous. They call them miscarriages, but I call them that is what a miscarriage is a spontaneous abortion. The body is saying, I can't do this. And women are actually
Exactly.
bleeding to death and dying and or being prosecuted or at least attempted to be prosecuted for having a spontaneous abortion for murder, which is insane. And their doctors being prosecuted for murder. Let's take the government back out of women's health care and reproductive rights because it's ridiculous that they're there in the first place.
Couldn't agree more. It's unconscionable that we could have one of our sisters, our daughters, our later mothers, late in life mothers, be prosecuted by the law
Hmm.
for some of these, yeah, events. You know, when I look at the election coming up, I mean, there are so many reasons to vote for President Biden and Kamala Harris,
Hmm.
but there are a lot of reasons to vote against the alternative. And because the alternative is offering nothing but retribution, and he's bragging that he is the one who reversed Roe versus Wade.
So women, don't forget
And
that he's bragging.
please don't forget that. Please don't
We know
forget
who
that.
did it.
I am not sitting here in some big fancy house. I'm a small town rural doctor, nurse practitioner, whatever you want to call me.
Hmm.
Uh, and I don't have a big, powerful platform. I'm looking around though at society, and I'm begging you, please don't let Donald Trump get back into the White House because all of the progress that we've made, and now we have the Dobbs decision that overturned versus Wade, they are going to just takes that to the absolute extremes, if they happen to get the White House and the Senate and the House, we will be in huge trouble,
It's frightening.
and we can't have that happen. And he's also vowed to reverse the ACA, to just he says replace it, but we know he doesn't have a replacement. This is the guy who went bankrupt on a casino. You know, the House always wins, except Trump. You know, Trump bankrupted a casino. If you think he can uh, create a comprehensive health plan, a law, a huge comprehensive law that has really worked well. I've got a few bridges in my back pocket. I'll sell you. Um,
And I'll throw in the ones that I got too for free.
yeah, absolutely. We'll have a bridge sale.
The Republicans' plan, should they retain the White House, the House, and the Senate, is to repeal the ACA. In fact, even when they did have it, while that idiot was in office, they tried to get it repealed, and it didn't work then. They have not, in what has it been, 12 years? 12 years now since 2012 that the ACA went into effect. Was it 12 years ago?
Yeah, I
They've
think
been trying to get rid of the ACA for that long, and they've failed every time. First of all, they don't have a plan. The Republicans don't have a plan for anything. They have no platform. They're running on retribution, on Donald Trump's retribution tour 2024. This is what they want to do. And not only will they try to strip us of the ACA, but they'll also get rid of Medicare and Medicaid, and that affects every senior citizen in this country and every child in this country. We can't afford to allow them to get back in and have health insurance companies go back to the practice of denying people health care or procedures because of pre-existing diseases or conditions. That's ridiculous. We can't go backwards in this country. We have to keep moving forward.
absolutely. And I would like to talk a little bit about because I don't know if a lot of people really understand exactly how the ACA is structured. And my personal opinion is I want to explain why I believe it to be a really solid setup. Um, as I stated when we first started, you know, President Obama figured out a way to kind of bridge together private enterprise and the power of government. So we have a system now where we have expanded Medicaid. Okay, so if you are, you know, low income or working poor, just you're just kind of scraping the surface, you're going to qualify for expanded Medicaid. So Medicaid, you know, it is not government ran insurance. None of this stuff is. None of the ACA is not government ran insurance. It's funded by taxpayers. The subsidies come back in to help pay for premiums and things of that nature. So we kind of have
Yeah,
two big pots.
there are healthcare plans that are provided by existing insurance companies that are
Exactly.
funded with taxpayer dollars
Exactly. And that's what I wanted to
at
kind
a
of touch.
at a
So
discount, no less.
so if you qualify, for example, here in my state, if you qualify for the expanded Medicaid pool, you're going to get an insurance card that is through either Anthem, Aetna, Humana, Passport, or United Healthcare.
Yeah, and these are all the
Now,
major healthcare insurer providers in the country that are for-profit providers. Okay, and
absolutely,
they're not just doing Medicaid. They're still selling insurance premiums to people who want to pay for better healthcare, who can afford to pay for that. They're still selling those.
absolutely. So we have
Hmm
we have expanded Medicaid coverage, which who most people, I say most here in my state, most people can qualify for if
Hmm.
you're making a decent living now, you can apply on the other side of the pool, which is the marketplace.
Correct.
And the marketplace is a brilliant idea because this is where like folks who may be making 60 or $80,000 a year as a family, say a family of four, they can log on to healthcare.gov or through their state's, direct connection, like it's Kentucky Connect, KY Connect.
Covered
I just call
California here in California.
You're right.
Hmm.
And most now, I will say this: not every state has opted in for the expanded Medicaid coverage. I think there are 10 states. Um, just right off the bat, there may be one or two more, but Alabama, Florida, Georgia, Kansas, Mississippi, South Carolina, Tennessee, Texas, Wisconsin, and Wyoming have not expanded Medicaid. Now,
All
I
red states,
think,
might I add. All
yeah,
red states.
and I want to say this real quick. There is a kind of a parallel. There's a correlation between the least healthiest states and that list. So a
Hmm.
lot of the states that are on the least healthy states list have not expanded their their Medicaid coverage. Now, so back to the Medicaid, you are getting a quality healthcare plan. If you qualify for the expanded Medicaid, you're going to get dental, you're going to get vision, you're going to get your outpatient medical visits, hospital stays, ER visits, medications. This is all part of it, and it's just a landmark kind of deal. Now the
And I know
marketplace,
here in
this
California, not only do they provide all of that, but they also provide screenings for certain conditions to make sure that they're on top of making sure that you don't have something,
absolutely,
they're
and
all a part of the plans too.
health screenings, preventative services,
Yes.
that's something I think personally, just looking back how the system was and where I have to run my practice, and I have to be so involved with every little aspect. I've had to learn honestly more than I would like to know about how insurance works. But
Hmm.
what we have seen is that over the last 10, 15 years, uh, since the ACA was passed, now all of the insurance companies, most insurance companies kind of follow what Medicare does.
Hmm.
So everybody is now providing these preventative services with no out of pocket costs. So if you have a Medicaid plan, or if you have a marketplace plan, who is it's like it, just like on the Medicaid side, it's going to be through a private insurance company. That's going to be a quality plan. You're going to qualify for an annual checkup. You're going to qualify for your age specific screenings like your colonoscopies, mammograms, pap smears, anything that you need that's preventative, vaccination. This is all going to be covered with no out of pocket cost.
That's awesome.
I've got a few other little bits of information I would like to put out to our listeners. So let's look at some percentages. 16% of our population here in Kentucky is enrolled in Medicare. That's about 684,000 people. 53% of that group of the 684,000 people have a secondary coverage with a Medicare Advantage plan, and those are also those are propped and subsidized through the ACA. So if you've got Medicare and you live in a state where the Medicaid has been expanded, more than likely you can go into your local office or you can get on your state's website. If you're 65 or if you're disabled and you have Medicare, you can get a Medicare Advantage plan on top of that so that you're not getting hit with that 20%. And a lot of times, this is the crazy thing.
Yeah, the one
The
problem I have with the
premium,
Medicare Advantage programs are that they are paid healthcare plans. Um, they're not your typical Medicare. And basic Medicare, or what they now call Medicare Original, um, covers just about anything that you need from medical wise without you paying extra. There are Medicare Original Medicare plans where the person actually covers about 20%. Okay, and that's where these Medicare Advantage programs say they cover that 20%, but they are actual health care plans that are sold under the name of Medicare, and they're not Medicare programs. They are
Yeah,
paid
it's
for insurance policies that you could buy direct from. And most people who have Medicare have been switching over to these plans, and they have to pay for more out of pocket costs to pay for the insurance program where they didn't have to do that prior to when they had Medicare Original. And I would just want people to know that they are paid plans, and to be careful when you're investigating those. It's important that, because I know people, and I myself am on the original Medicare plan, and I pay for little or nothing. I pay a small fee for my prescriptions, and that's about it.
Yeah. So just in case any of our listeners kind of don't understand how this works, I do want to just say this about the Medicare Advantage and supplemental plans. So there's kind of a couple different things going on.
Mm-hmm.
In the states though, where you have these subsidies, if you now, just like Bernadette said, you have to be careful. But if you get in with the right people that actually are trying to help, or if you go with your state office and you get it with one of your state representatives in the offices that do all this, you can get that additional tier of coverage a lot of times with Medicaid. So you'll have
Mm-hmm.
your primary,
Exactly.
your Medicare A and B, and then you'll have a Medicaid card also, so that you're covered.
And that's what I have. I have a Medicaid card, or Medi-Cal here, and that's what they call it here in California, Medi-Cal. And so a lot of the additional coverage is picked up by Medi-Cal or Medicaid in these other programs. But yeah, just be careful, because see, George W. Bush, when he was in office, came out with the Medicare Advantage programs, and it was to privatize Medicare. And that's what they've been trying to do. So you got to be real careful about what you're buying that's considered Medicare Advantage. And I just want to give people that heads up. So if you're in a state that has the Medicaid coverage, they will cover that portion. Um, if you're not, be very wary of what's being called Medicare Advantage.
Yeah, and so when we look at our percentages, we have a huge chunk of the population um, that is covered with Medicare, Medicaid, or both.
Mm-hmm.
So if we have a situation where a Donald Trump rips away the ACA, we are going to see in an instant, 40 million Americans are going to be affected in some way, shape, or form. Most will just simply lose their coverage.
Mm-hmm.
And then they're right back to where we were talking about, where you've got pre-existing conditions that have been
Mm-hmm.
documented, and now you're trying to get health insurance through some of these private companies, and they're just going to say no. And
Oh, they'll
so,
sell you insurance for a fee, and it'll
yeah,
be
yeah,
astronomical. It'll be something that you cannot afford, and thus, in effect, you're underinsured or no insurance whatsoever. And this is the Republicans' plan, y'all. It's important that we get out in November and we vote blue all the way down the ballot. Your governors are the ones who are making these decisions about Medicaid in your state. Think about that.
Exactly. If you live in a state that has not expanded Medicaid, get on your phone, make some calls, call your state representatives, call whoever you can, write, email, do what you can. Let them know that you, as a citizen, are interested in this and you want this. A lot of times we think it's not going to do anything, but guess what? Somebody else is doing it too. And when the numbers build up, the pressure builds up, and that's how we change things. Applications can be made directly through healthcare.gov, or you can apply through the state-based office. Pregnant women with income up to 218% of the federal poverty level can enroll in Medicaid. Pregnant women and postpartum women with an income too high may enroll also. There are a lot of ways for that to happen. Children under the age of 19 in households with incomes up to that 218% of the federal poverty level can qualify for a lot of the children's health insurance programs. So there are a lot of ways to get covered, and it's easy. It doesn't take a long time, so take advantage of this.
Can you give that website out again?
Yeah, healthcare.gov is the federal website that sort of directs you to your state website and gives you a lot of information. And before I was preparing for the show, I also found that, if you're an employer and you have, like, say, 1 to 50 employees, you're a small business and you're
Mm-hmm.
trying to get health insurance for your employees, they offer a marketplace coverage for businesses.
They
So
do.
it's a great program, but we cannot let this get ripped away. And Donald Trump has vowed to rip it away. John McCain saved us, with
Yeah.
that thumbs down, that famous thumbs down vote. Now Trump's took another chance to make a swipe at John McCain, and why he couldn't raise his arm up right. He gave it a thumbs down because he knew that it had become an effective piece of of how we are secure in
It
with
was,
our
a, it
health.
was a great piece of legislation. Fortunately for American people, it passed, and we need to make sure that it stays in effect. And we do that when we go to the polls in November and we use our voice by using our votes.
Absolutely. Stand up and be counted, folks. This is the election where if you are sitting and looking at the polls, if you're looking at the candidates and you're not sure, this is the one to get behind, President Biden. This is the one.
It certainly is because should anybody else get into office, it might be the last one we ever get. So think on that. And John, I want to thank you for visiting us at Left on the Table. And trust me, you'll be back here. So keep gathering these numbers, keep gathering these websites, keep gathering that information because we're going to throw it back out there. We are not going to leave this issue left on the table. Thank you.
Thanks, Bernadette. And I just want to add one thing to you can edit this and source this in at the beginning or end. The source for most of my statistics was from the McCourt School of Public Policy, Georgetown University Center on Health Insurance Reforms.
Right on. Thank you, John.
Hey, thank you. I really appreciate. I had a lot of fun, and I
We'll do it
really
again. We're
I'm
going to do
thankful
this
for this
again.
family. I'm thankful for this family. We had a great conversation, Bernadette. I
We
really
did. And
did.
thank you for being my first guinea pig. You made me
You
feel
are
really
welcome.
comfortable. You made me feel really comfortable. You hear that, Travis? I'm going to push stop now. Okay?
Stand up and roll. Stand up and roll. Oh yeah.
Thanks again, John, a Blue Dot in the Bluegrass, for stopping by. Today's episode was hosted by Bernadette Pree. The music is from John Lawrence. You can find his music available over at jhlawrence.bandcamp.com. Left on the Table and all other programming on the Blue Dot in Texas channel is made possible by the kind donations from the Blue Dot family. You can visit abluedotintexas.com to find out how you too can help keep us on the air. Thanks again for listening. And remember, keep using your voice and vote.